girl Bree Nicole, and I'm back with another video, and this is going to be part 2 of my LPN program little series. So next I'm going to be talking about my second semester of this LPN program. I'm going to start off by saying the second semester started in the fall. It started at the end of August and ended like the first week of December. The cost for tuition for second semester of nursing school was like $1,300. I already had my ebooks, so I didn't have to buy any more books unless it was just like optional books that I wanted to purchase online, which I did for extra help. So class days for second semester of this program was just 1 day a week. Since the fall was longer, class was only 1 day a week, and clinical was anything from 1 day to 3 days a week. It just depended on how it fell on your clinical schedule. So I'm going to talk about what we learned in class next. They uploaded a test outline to Canvas with all the topics that we were learning this second semester. They uploaded our clinical schedule and then another calendar like I showed y'all in the first video. So the calendar just consisted of our class days, test days, and lab days, and we just had to fill in like the days we had clinical to keep this schedule in our binder, which I did every semester. So I'm just gonna go over the test outline of the things we learned in the second semester. We started med-surg this semester, pediatric and adults. It was combined in my program. It wasn't separate classes, so it was like med-surg throughout the lifespan, starting from pediatric up until geriatrics. So test 1 consisted of infection, inflammation, tissue integrity, peri-op, colostomy care, which was like a lab, part of lab, but we actually had like some test questions about it. And then other lab stuff was suture and staple remover, and then math consisted on every test. So we didn't have a pharmacology dosage calculation class. We had dosage calculation questions included on each test. We will only have like 3 to 4 math questions, sometimes 5, but 5 would be the most because each regular test consisted of 50 questions. So like up to 5 of those could be math questions consisting of like dosage calculations, IB math, anything that we learned already. So test 2 was mobility, sensory perception, cell regulation, insulin administration, and math. Test 3 was perfusion, oxygenation, some lab stuff, trach care and suctioning, oxygen delivery devices, and math. Test 4 was fluid and electrolytes, acid-base balance, nutrition, elimination, giving meds through a PEG tube, IV lab and venipuncture, Foley catheterization, which was lab, and any type of math. And then we had our HESI final. So yes, my school used HESI finals for our final exams. Okay, for test 1, infection consisted of cellulitis, osteomyelitis, UTIs, pneumonia, ear infections, influenza, conjunctivitis, and tuberculosis. Those were the med-surg topics. And when we talked about a topic, we did like the concept view of a topic, and I'll try to include a picture of a concept map. Our teacher uploaded a blank concept map also to Canvas that we can print off, and we can put each topic in the concept map. So the name of the disease process will go in the center, and then we would have signs and symptoms, treatments, medications, nursing implementations. So like, what are you gonna do for that as a nurse? The pathophysiology, so how is it caused? How does a patient get it? Diagnosis and labs that are used to determine if a patient does have this. So like, if someone comes in thinking they have the flu, what are you gonna do? How are you gonna test them with a flu swab? Things like that, like x-rays, MRIs. Patient teaching, what are you going to teach your patient once they are getting ready to discharge? Okay, so tissue integrity consisted of pressure ulcers, contact dermatitis, anything like with the skin, wound healing. Peri-op consisted of what to do during surgery. So like if you plan on becoming a surgery nurse, it was just they went through the stages of surgery. So it was like pre-op, intra-op, and post-op, like what's done as a nurse in the operating room. Inflammation consisted of appendicitis, gallbladder, inflammatory bowel disease, pancreatitis, hepatitis, and celiac disease. All of that was on test 1. So test 2 consisted of mobility. So it was back problems, fractures, hip fractures, multiple sclerosis, and Parkinson's disease. Cell regulation was osteoporosis, diabetes in adult and children, liver disease, and thyroid disease. Sensory perception was seizures. And that was all that was on test 2, besides like the lab stuff that I mentioned. And then test 3 was perfusion, which was DVT, PVD, hypertension, and heart failure. And oxygenation, which consisted of asthma, COPD, respiratory failure, respiratory viruses, bronchitis, sudden infant death syndrome, and cystic fibrosis. And then test 4 was elimination, which is like renal diseases. So it was BPH, kidney stones, bowel obstructions, incontinence, fluid and electrolytes, and acid-base balance, which was metabolic acidosis, metabolic alkalosis, respiratory acidosis, and respiratory alkalosis. Fluid overload versus dehydration. And like I said, sodium and potassium, calcium, magnesium. And then we talked about like IV fluids and what they do. So like normal saline, lactated ringers, D5. And nutrition consisted of peptic ulcer disease, internal nutrition, GERD, pyloric stenosis, hiatal hernias. And that was all that was on test 4. And like I said before, you have to do a lot of studying. As you can see, it was a lot of stuff on each test. These were literally like 4 to 5 concepts on each test. It was a lot. It was a lot to study. It was a lot. You had to study. That's why I say you have to study a little bit each day, because some class days we would be learning the whole module. So yeah, you would go home and have to like go more into depth. And like I said, when we talked about each disease process, we talked about it using the nursing concept map. And to help me study in nursing school, I utilized the Saunders book a lot for Med-Surg, and also Med-Surg Success. Like I used Fundamental Success for the first semester. These 2 books really helped me pass the second semester, and I actually passed with, I think I had like an 80. And then for my HESI final, I used Your Best Grade. And Your Best Grade is divided into like sections, I guess classes. So it was Med-Surg, Pharmacology, Fundamentals, Mother Baby, Psych. So I just had to go take the Med-Surg questions and quizzes on Your Best Grade. And you do have to pay for Your Best Grade, but it is really helpful. Like, it was really helpful for me, and a lot of my classmates said it was really helpful for them as well. So if your school uses HESI, I would suggest investing in that. As far as labs for this second semester, like I said before, we did Foley's, IV meds, so IV piggybacks, IV pushes, starting IVs, blood administration, trach care and suctioning. We also learned to give meds through a PEG tube, because we didn't talk about that in first semester. So we did talk about PEG tubes and how to give meds through that, and like the nasogastric tubes. And we didn't have as many lab days in this second semester as we did the first semester. We had 4 lab days to practice skills, and then we had a check off. And as far as clinical days, like I said, clinical days could be anything from 1 to 3 days. It was just depending on what clinical group you were put in and how y'all were put on the schedule. And we only had Med-Surg clinicals. We had rehab facility clinicals, kids check clinicals, which was when we went to elementary schools to check kids for scoliosis. And then we had like a kids expo day at our community college. It's where about, I want to say like 25 elementary schools came to our college, and the different health science programs set up different stations in our health science building, and they just pretty much went from station to station learning about stuff. We had a blood station and a vital signs station for my class, and then it was like EMTs, paramedics. They showed them like the ambulance bay. The radiology program showed them about x-ray. It was all the programs at my school, and they just went around and rotated. So that was really fun to get to like do that for elementary students, and they were like amazed at like learning how to do vitals and us doing vitals on them and stuff. We also had a simulation lab day, and if I can remember, it was just like where they had the mannequins and stuff. They were just showing us like different things we would see on patients in the hospital when we first started med surg. So it really wasn't a day of us like actually doing stuff. It was like our teachers were demonstrating stuff to us since we were starting to go into the hospital. And as far as clinical days, like in a hospital, in our clinical tab, our teacher uploaded a sample nurse's note, a sample way to do like a head to toe assessment, how to chart on the patient. So they pretty much got us prepared. Depending on who we went to clinical with, sometimes they made us write a head to toe on just one patient. And then sometimes we had this little software. It was like a fake charting system called, I can't even remember the name, but it was like set up like a hospital charting system would be. So it was like click boxes. It was something the school invested in. We did have to pay for it with our tuition, but they would tell us to bring like a laptop or like an iPad to like click chart on a patient. We didn't enter our real patient's name. We just put like John Doe, and we would go through the click boxes on practicing how to do head to toe assessments electronically. So like when we went to med surg clinicals, we got to administer medication, do AccuChecks, vitals, administer insulin. We still helped the techs with ADL, so with baths, linen changes. We helped patients ambulate. We did dressing changes since we had checked off on that. And I forgot to mention that we also did sterile dressing changes, and then we also did central line dressing changes and checkoffs. So anything that we had checked off on, which was pretty much everything, we were able to do. So we were able to insert IVs now, give IV medications, insert Foleys, trach care, Foley care, dressing changes, sterile, wet to dry dressing changes, or just dry gauze dressing changes. We got to do all of that starting the second semester. So we were really busy, and clinicals were only from 7 to 3. Class days were from 9:30 to 12:30. But when we had a test, it was from 8:30 to 12:30 because we had to use that extra hour to test. So that was pretty much everything we did my second semester of nursing school. It was from August to December, and we did get like a little small break during Thanksgiving. So that's everything that I can think of that we did in second semester. But if I didn't mention something, don't hesitate to comment down below and ask. So don't forget to like, comment, and subscribe. And I'll see y'all in my next video. Bye, guys.